So I'm a gastroenterologist, and I practice and live in the suburbs of Detroit, Michigan. I'm a big sports fan.
He became the Rhodes Scholar representative as well as the homecoming king at Ohio State.
You know, what we're trying to do is replicate what you would have, for example, in my office. You know, we want to be real and answer questions that are tough sometimes. Take a topic and really understand it and develop a solution. At the end, we'll help the patient that's in front of us and also help the patients at home as well as in the studio audience. That's the essence of what we want to do.
Hello, and thank you for that wonderful welcome. And at home, thank you for watching. Today, we're talking about food allergies affecting up to 15 million Americans, including 6 million children. Now, food allergies happen when the body develops an immune response to a food. This reaction can give you GI distress, dermatitis, and rarely an anaphylactic reaction, which can be life-threatening. So what causes food allergies? Now, with an allergy to a food, the body releases antibodies when you first eat this food. After this time, whenever you eat even a small amount of that food, an allergic response can occur. Most commonly, we see milk, eggs, wheat, soy, peanuts, tree nuts like almonds, cashews, and pistachios, or shellfish. These could all be involved. Now, what are the risk factors? What are the risk factors that increases your chance of having food allergies? Having family members with asthma, eczema, or hives place you at higher risk. A past food allergy or another allergy to food gives you more of a risk. Children are more at risk as well as patients with asthma. Now, symptoms from food allergies can be different for every patient. Now, some patients can have very mild symptoms with tingling of the mouth to eczema to more severe symptoms like difficulty breathing and potentially life-threatening anaphylaxis. You can see abdominal pain, nausea, vomiting, and diarrhea. Now, how do you diagnose food allergies? A history of the patient is very important, as well as an examination. A food diary is very useful. Now, allergists perform skin prick tests, blood tests, and food challenges in making the diagnosis. So what about treatment? For minor reactions, antihistamines may be very useful. However, for more severe reactions, epinephrine is used. Patients with food allergies can often carry an EpiPen to treat a severe reaction. Now, let's take a look at the story of Jen McGregor and her experiences with food allergies. Please watch with me.
I'm Jen McGregor, and I've been a lifelong allergy patient. I have many food allergies and environmental allergies and also pet dander. They can come on at any time in life, so if you ever eat anything and something feels funny, it's a good idea to get it checked out. I had a friend of mine that's a touring musician that he actually collapsed at the desk in his hotel room after eating shellfish. He's 46 years old. He never experienced that before.
When we come back, we'll meet Jen. Please don't go away. Did they find out you were allergic to certain foods?
Oh, they put me down for basically 97 out of 100.
Oh, wow. Not a good thing. Welcome back. We have now joining us Jen McGregor. Jen, thank you very much for coming on the show.
Thank you for having me.
Oh, you're welcome. You know, Jen, we ask everybody that comes on just to tell the audience here at home just a little bit about who you are.
Well, I'm Jen McGregor. I'm 39, unemployed bum right now. But
Well, it's a toughie.
play guitar, do some photography in my spare time, and I've been dealing with allergies for all my life.
You play guitar. It's awesome. Great. Well, we'll talk about that another time. But food allergies. Now, tell me, when were you first diagnosed?
My mom said that they knew I was going to have problems from the week I was born.
Oh, wow.
That was projectile vomiting, Enfamil, and everything they tried to give me.
Okay.
So I finally got a diagnosis when I was 4 years old.
And so, so here's you know, we have a situation where when you're first born, you're projectile vomiting. There were a lot of causes for that, but they thought maybe you were not tolerating your whatever the formula was that you're given, right?
That could be.
Yeah. And then when you obviously don't remember because you were an infant. But then when is the first time you remember that you were given the diagnosis of food allergies?
I remember definitely being 4 and screaming my head off because all those little needle marks in my back.
Oh yeah, for the testing.
Yeah.
Now, tell them about that, because she's saying you got these little needle marks in the back, and what is that from?
They take basically a toothpick and they put a little hole in your back, and then in each hole they drop a little dab of what they suspect your allergen is.
So you went to an allergist. So what happens is that when you suspect you have a food allergy, you go visit an allergist, and then they do this this testing. And so they were doing the testing on your back, and you said it was uncomfortable, huh?
It's calamine's your best friend after it.
And so when you had that, did they find out you were allergic to certain foods?
Oh, they put me down for basically 97 out of 100.
Oh wow! So you had lots of allergies.
Yeah.
And so you're 4 years old. And so what did you do? Do you remember? I mean, what did your mom do? What did you eat?
We just started. They basically told us that I was allergic to so many things that I couldn't avoid my allergens like as what is normally prescribed. But
because you're allergic to so many things, you mean?
Yeah.
Okay. Okay.
So what they did was said, mix it up. Have chicken one day. That's one of the things I'm not allergic to.
Good.
Everything else, turkey, I'm allergic to, so we'll have that another day. Beef another day. Just try not to
have the same thing every single day. So at least mix it up. We talk about this and we think about it when you don't have food allergies. It says in passing, oh yeah, the person's allergic to this, and we have to watch what they eat. But when it becomes a part of your life, it's a very different story, isn't it?
Yes.
I mean, every day you have to worry about exactly what you put in your body. And this is what we're trying to do to educate people on the show, is that when you have this disease, a lot of us take it very casually because we don't have the problem, but you did. How did you deal with it as a kid? I mean, as a kid, my daughter eats everything. I mean, anything she can find, and to have her think about every food and have to worry about what she takes. How did you deal with that?
My parents basically educated me right from the get-go that you're allergic to this, and if you eat it, you're going to have diarrhea, you're going to be nauseous, you're going to be miserable, so you don't want to eat this every day, no matter how much you like it.
Now, what about when you went to friends' houses and things like that?
At friends' houses, it was just, I know I'm allergic to this, and I really can't have it.
Was it hard, though?
Yeah.
Yeah, I mean, you can imagine, young Jen going to somebody's house and you have to do everything special every time you go. It's difficult because your friends, it's difficult for your friends. So I can see I imagine how it could be for you. Now, tell me about, as you got older, what happened? How did you deal with it?
I would just, as a teen, I had brown bagged my lunch, and that way I had no problem with going up to the school cafeteria.
Because you brought your food, so you knew that it was safe.
Yeah.
Okay.
Yeah, and then as an adult, same thing, make my own meal, and then mix it up the next day, something different the next. I also had to learn with restaurants as to which ones have MSG in their foods.
Yeah.
Because we'd have like a company boss that would take everybody out to eat, and I'd be like, I know this place has MSG. I know if I eat that spaghetti, I'm going to be miserable.
For the rest of the day, huh?
Yeah, so then I'd order a salad, and my coworkers would be like, you're thin enough. Why don't you eat real food?
Oh, it's terrible. And this is the lack of education that we have out there. It's people don't understand how serious it can be. A very important point that you made. Going to a restaurant, you have to be able to advocate for yourself. We've talked about this in different shows. Whether it's a doctor, whether it's a specialist, or whoever it is, you've got to be able to say, listen, you can't be afraid that you're going to insult somebody or make somebody feel bad. I mean, this is your health. So what happens is that when you go to restaurants, make sure you let them know what your allergies are, and then make sure that they know what things to avoid. And also, so even before you order, so they don't mix and prepare somebody else's food along with yours and then get a reaction. Did you ever get anything more severe than the nausea, vomiting, or diarrhea? Anything more than that?
Nothing more than that, except sometimes I'll get like a bright red rash. It looks scary. I tell my friends, relax, I'm fine. It'll go away soon.
That's scary for them though, huh? I'm sure, and for you.
Yeah.
And how often does that happen? Does that happen a couple of times in your life?
Every so often. It's red wine is the trigger for that.
Oh wow, so
And I like a
glass of red wine every
so often.
Yeah, who doesn't, right? Right. I mean, lots going on. When we come back, we'll talk more with Jen and about her life with food allergies. Maybe some tips for you. Please stay with us. Nice job. Easy, right?
I think the biggest advice is for everybody to be knowledgeable about their allergies. Teach their kids right from the get-go so that, the kids know the symptoms, the treatment, what the allergen is.
Like as an adult in general situation. Welcome back, and we've been talking with Jen McGregor about her experience with food allergies, and we talked about you as a child. How about as an adult? Did your allergies change? Did anything change over time?
Some of them did decrease. I used to be allergic to things like flour and wheat. Those cleared up. Some of the others have cleared up, but still to the point where it's like, still got to be very careful about what I eat.
And what about when I'm sure you have to go out with your coworkers and stuff? Does that ever pose a problem for you?
Yeah, like I've had it where with ordering salad instead of spaghetti, knowing that hey, the rest of the day if I order that spaghetti, you're going to have to move my workstation into the bathroom. So that's not fun. And then another time I was able to eat, and they actually wrote it on the calendar. Jenny ate. It was just like they thought it was funny. I was just so embarrassed.
And this is this is why we're doing these kind of shows, because we'd like to educate people. And you can't do these kind of things. It may be like, oh, it's funny, or she's making a bigger problem than it really is. It's not. It's truly a problem that can encompass your life. And if you're a loved one or a family member or even a coworker, support the person so that they don't have more difficult. It's difficult enough as it is, but don't make it more difficult. That's the message. And then what about the doctors? Have you ever had anybody that has treated you different because of your food allergies? Often people think, well, you're allergic to everything. How can that be true? And dismiss it. Or sometimes people think everything's an allergy. Has that ever happened to you?
Well, I did have it where I went into the doctor's office. I was feeling really sick.
Yeah.
Had 106-degree fever, and they wouldn't let me see my normal doctor. They had me see somebody else who said, oh, it's just allergies, go home. I'm sitting there like, this is not allergies. Sure. I know my allergies, this is not them.
What kind of infection did you have? What was that going on with you?
It was bronchitis, and when I went back the next day, they said it was bordering on pneumonia. And as a result, I ended up losing approximately half of my hearing.
Oh, wow.
Yes, I've been wearing hearing aids for 9 years.
Oh, my. This is, again, we talk about patients, but as healthcare providers, we're always, we're not immune to this. We have to be educated and understand that food allergies will not often give you a temperature that's high. And if you don't know that, and if you treat someone that way, that everything is an allergy, I mean, it's erroneous. And we have to, again, be educated, understand this more, and not just dismiss it as a side effect. I mean, people sometimes think food intolerance is the same thing as a food allergy, and we have to really break that myth. And I'm sorry that happened to you. I mean, it's terrible. How about your family? I mean, is there anybody else with food allergies like you, or asthma, or anything like that?
Not as bad as me, but my cousin could be really close. I don't get to talk to him very often. As an infant, they almost diagnosed him with cystic fibrosis.
Okay.
Because of all his coughing.
Yeah.
And the thick mucus drainage.
Yes.
I get that too.
Sure.
The rest of the family seems to have mild allergies.
And anybody with asthma in your family too?
I'm actually on my first inhaler.
Are you really? You have asthma?
I was supposed to be on one as a little kid, but I never needed it until recently.
Well, you should definitely. We had an episode on asthma. You should definitely be proactive and make sure that if you're prescribed, a medicine, take it, especially for you, because over time this can get worse. So, again, we're not talking about asthma, but just stick to your treatment regimen, because sometimes food allergies, eczema, asthma, hay fever can all exist together. So it's very, very, very important. Now, what's your treatment now besides just avoiding the foods? What else do you do?
I have Zyrtec.
And explain what Zyrtec is to people who have never taken Zyrtec.
Zyrtec is over-the-counter allergy medication.
Okay.
I've got Pepto-Bismol on hand at times. Definitely need that for the nausea.
For your GI effects, yes.
Antidiarrheals. I've got Benadryl for any extreme allergy.
Yeah.
And of course, I've got a pile of books in the bathroom for those long and infrequent trips.
Oh, I bet. You spend a lot. I bet where every bathroom is at work, And I bet you know where
If I
every
was
bathroom
working.
is on your commute to work, because you never know.
Yeah.
You never. This is, you know, again, we've talked about irritable bowel syndrome. We talked about many diseases. You know, you cannot discount how important it is when you have to use the bathroom immediately. I mean, in our state, there was a woman who had not irritable bowel syndrome, but inflammatory bowel disease, and went to a store to use the bathroom, and they said, "Nope, ma'am, we cannot let you use the bathroom." And she had a white dress on, soiled herself, and with her kids, and to the point where she was so embarrassed, and she went to the legislation, and they passed a law. If you have certain diseases and carry a card, that they have to let you in the bathroom. Why am I saying this? Is because we as a society have to take notice that there are some diseases that really need our understanding and our support. You know, it's very important. We don't have a lot of time, but I want you to tell me in your own words, and tell America in your own words, something about food allergies, your opinion about them, any advice you can give us.
I think the biggest advice is for everybody to be knowledgeable about their allergies, teach their kids right from the get-go so that, you know, the kids know the symptoms, the treatment, what the allergen is. I think people need to be a little more accommodating too. That
Absolutely.
they've got to realize that.
And be more understanding,
Yeah.
including healthcare providers. I mean, not just the general public, but healthcare providers. Jen, I want to thank you very much.
Thank you.
That was so nice of you to come on and tell us all about what's been going on with you. It really was helpful.
Yeah.
I appreciate it.
Thank you.
Thank you. When we come back, we'll be talking to Dr. Gursharan, Dhillon, our allergist, and he'll give us more tips. Please don't go away. Very nicely done.
About 25% of US population perceives they got food allergies, but in actuality, there are only 6% of patients who have actual food allergies who are less than 5 years of age, especially in children.
Okay.
But in the general population, about 3 to 4% of patients, they have actual food allergies.
It'll be on Wednesday. Welcome back. You know, we now have Dr. Gursharan Dhillon, our allergist, joining us. Dr. Dhillon, thank you for coming on.
Thanks for inviting me.
Oh, no problem. You know, we ask everybody to tell a little bit about who they are. Can you tell the audience here and at home a little bit about yourself?
Sure. I am Dr. Dhillon, practicing allergist in the Rochester, Michigan area. I've been in practice for the last 7 years since I finished my fellowship training in allergy and asthma.
And then you also did internal medicine pediatrics.
Yes, that's my basic training, and the additional training of 2 years for allergy and asthma was done at Wayne State University from 2003 to 2005.
So very smart man. Internal medicine, pediatrics, allergy, I tell you.
Thank you.
Thank you for joining us. And then tell people, you know, I don't think a lot of people know what an allergist does. So what does an allergist do every day?
Well, allergists are people, specialists who are specialized in diagnosing asthma, allergies, and immune deficiency diseases.
Okay.
So these are the patients which are referred by primary care physicians to allergy specialists.
Perfect. People just always think of allergists as the little,
Sneeze doctors.
The sneeze doctors.
Yeah.
Nice. Like Jen said, you're always worried about the pinpricks in your back. You do much more than that, obviously.
Right, exactly.
So great. Well, now food allergies. Tell me about in your practice. How commonly do you see food allergies?
Well, about 25% of US population perceives they got food allergies, but in actuality, there are only 6% of patients who have actual food allergies who are less than 5 years of age, especially in children.
Okay.
But in the general population, about 3 to 4% of patients, they have actual food allergies.
Okay, so it's much less than perceived. You know, Dr. Dhillon said 25% feel like they have food allergies, and that could be a mix of food intolerance and allergies,
exactly.
and it's a much smaller percentage, but still can be an important problem, right?
Absolutely.
And it seems to be increasing. What do you think is going on?
Well, yeah, the general public is becoming more aware of food allergies in
education.
Exactly, in education. And also the patients, they are getting more and more information from the internet and from their peers, and also
from the internet.
From the other patients. Also, the physician in primary care, when they diagnose these common ailments and the patients don't get better, they seek some extra avenues for their patients. That's how the patients are referred more and more to allergy specialists. In US, the CDC had a guideline that about 18% of US population has diagnosed with more allergies since 1990.
Wow.
So there has been an increase in allergy spectrum of diseases, especially in 2008, there were 51,000 patients diagnosed with food allergies and anaphylaxis.
Oh, I see.
And it was only about 21,000 in 1998.
Right. So important points that, you know, by the way, a primary care doctor, for those of you who don't know what that means, you know, family practice doctor, internal medicine, pediatrics, we call them primary care because they're often the first doctors that people see. It's important. We always talk about this. Some people call them PCPs, but primary care doctors. So they are seeing the patients first, and then they're becoming more and more aware of this entity. You know, for example, Jen, you know, in her conditions, that the allergy, you know, the doctor who didn't really know a lot about the allergies and thought that was the reason why she had the temperature, you know, we're getting more and more aware. And in the public, they're becoming more aware. So you know, I still don't believe, I still stick with my stance that if you think you have a problem, and have a doctor assess and then let you know if it's food intolerance or an allergy, because I think I'd rather be err on the side of safety.
Exactly.
But your point's well taken that lots of people use that word food allergy and throw it around a lot because it's important to distinguish that between food allergy and food intolerances. Now, what is the difference between the allergy and intolerance? I mean, I have a bean burrito and I have stomach upset, and then, you know, that's not an allergy, right?
Exactly.
Right.
Well, you know, it's very important to distinguish between food intolerance and food allergy. The food intolerance is just an adverse reaction to a food. For example, it could be because of the food itself,
Sure.
or it could be the characteristics of the host. For example, patients who are lactose intolerant.
Yes.
It is not a food allergy, it's food intolerance. Patients who are lactose intolerant, when they take milk or dairy products, they will have bloating, diarrhea, or abdominal pain.
Sure.
That is just food intolerance. For example, you can get food poisoning from eating bad food.
Sure.
The bacterial toxins can cause fever, nausea, and vomiting. That's a food intolerance. But the food allergy is an actual immune reaction of your body to a certain food.
When the antibody is released.
Exactly. And that mainly could be IgE mediated, which means when the patient will have IgE antibodies in their blood.
So you said so just so those of you who are going to follow along, it's IgE. It's immunoglobulin E type, and that's another antibody that your body produces in reaction to something, and in this case, the food.
The food.
Please.
And in those patients who have IgE-related food allergy, the reaction can get more severe, and it can reach to a point of anaphylaxis. And the patient can die from that.
What is anaphylaxis? I've used that word too, but I wanted to, maybe people at home have never heard anaphylaxis, can't even spell it probably.
Sure.
And what is that?
Well, anaphylaxis is a shock-like reaction which can happen in relation to a food allergen or to a medication. And patients who have acute anaphylactic reaction can lose their blood pressure or pulse immediately, and they can die within a few minutes of getting the anaphylactic
So pretty
reaction.
serious.
It's pretty serious.
And this is an important, point where we're talking about that food allergies can be very mild, but also can be very serious. And if you have an anaphylactic reaction, you lose your blood pressure, lose your pulse, and you basically die.
Exactly.
And that's why a lot of patients, that have this kind of problem carry an EpiPen, which has epinephrine, which can reverse this pretty quickly. And that's why we brought up, that sometimes you may have to use a medical bracelet and to let people know, because if you're down, nobody knows what's going on. And so that's an important point. A great point. When we come back, we'll have more with Dr. Dhillon. Please stay with us. Good evening.
You can also have development of allergies later in the life. It's just like getting any immune disease at 35 or at 45. Your immune system can change anytime. So when patients come to me in my practice and they ask me, why did I get allergies suddenly at 45? That's the explanation which we have.
Your immune system
can change and become hypersensitive to a food which you've been eating all your life.
Welcome back, and thanks for staying with us. We've been talking with Dr. Gursharan Dhillon, an allergist, about food allergies. Now, we talked with Jen earlier. What do you think about Jen's experience? Is that very typical? Is it very severe?
Well, I heard Jen's story, and it sounds pretty dramatic in terms of the amount of allergies she has. And that is pretty typical, I would say, course of the illness. But not most patients, like Jen, will have that many allergies.
I see.
They are diagnosed at an early age, but most of the kids who have milk, eggs allergy, they can outgrow the allergy. But the allergy to tree nuts and peanuts, they generally don't tend to go away. But 1 out of 5 children can have no peanut allergy after 5 years of age. By 12 years, about 1.5 out of 5 children can have no allergies to peanuts, but most of these allergies stay all their life.
I see.
You can also have development of allergies later in the life. It's just like getting any immune disease at 35 or at 45. Your immune system can change anytime. So when patients come to me in my practice and they ask me, why did I get allergies suddenly at 45? That's the explanation which we have.
Your immune
that
system
your immune
has
system
changed.
can change and become hypersensitive to a food which you've been eating all your life.
Perfect. The answer is that, you know, Jen's experience may be somewhat typical. Is that most people outgrow some of them.
Right.
And she said, you know, she can now, I think, eat some more foods than she did when she was a child.
Right.
So it's somewhat. Now, what do you do when a patient comes to you with presenting with food allergies? What's your approach in general?
Well, I think you already had outlined it in a nice way, how we diagnose a patient with food allergies. When
Sure.
a patient comes with the spectrum of symptoms, we have to really distinguish between a food intolerance and a food allergy.
Right.
I think it's very important to ask medical history, which is the keystone of any medical diagnosis. We sit down with the patient, we ask medical questions. What does the food cause to them? How do they know it is a particular food? Did the same food cause repeated symptoms? Once we know that the patient has very typical food allergy symptoms, sometimes the patients are referred by gastroenterology specialists. They will come with a biopsy of their esophagus, which shows eosinophils in their food pipe.
Those are just cells. So he said eosinophils, which are just cells of inflammation.
Exactly.
Maybe kind of pointing to or alluding to an allergy that the patient may have. Yes.
And those patients, they have a documented diagnosis. They have some allergen which they put in the body, which is causing these eosinophils to migrate to their esophagus. The gold standard which we use in the medical practice is skin prick testing. As Jen mentioned, in
Skin prick testing.
Skin
Okay.
prick testing.
Okay.
It sounds scary, and I think she had testing done a while ago. Nowadays, we have these plastic prongs which we use on the back. They don't cause much pain. It's a little uncomfortable, but doesn't cause any bleeding.
That's good.
Then we also put a positive and a negative reaction on the patient's back. Depending upon the reaction of the food extract, if any food is more than 3 millimeters more than the negative control, that is considered a positive food.
Perfect.
I don't test more than 50 foods in my office. I know Jen had almost 100 foods tested, and she tested out
97
of them.
Yes.
Then the gold standard of testing also is the double-blind food challenges, which are only done in hospital settings and for the research studies.
Okay.
If the patient has a lot of eczema and the skin is really full of rash, we can do the IgE testing in blood.
To look for the immunoglobulins. We talked about that IgE. It's to look for the immunoglobulins or the
Exactly.
antibodies that the patient may have.
Right. That test is not as sensitive as the skin prick test which we do in the office, and it takes only 20 minutes to do that test.
And because other things can produce the antibodies. Important points that Dr. Dhillon made was when you've got to listen to the patient, and one of the things is that do you have a reaction to food and it repeats itself?
Exactly.
Is it repetitive? Because if you have a reaction, it's not just go away after one time.
Right.
And then once you suspect the diagnosis, the best way is to do the pinprick test to find out, and then you can go into treatment. Now, what is the treatment that you normally approach patients with?
Well, the treatment depends upon the extent of symptoms the patient is having. There are a different spectrum of food allergies like oral allergy syndrome. Patients who eat raw fruit, they'll just get oral tingling, lip tingling, but there will be no lip or tongue swelling. In those patients, they are told to either peel the fruit or just take antihistamines before they eat that particular food. But if the patient is going to an extent of anaphylaxis, which is a much more serious condition, we teach those patients how to treat themselves with epinephrine injection. That's a life threatening reaction, and the patient should be very well educated about medical bracelets or a necklace, and also how to use an epinephrine. And they are definitely told to read every label when they go out and eat in a restaurant or they buy any groceries from any grocery store. And even we have such difficulty in controlling those kind of reactions because the labels on the foods are not very specific sometimes.
They're vague often.
They're very vague. It'll say may contain peanut products, may contain milk, and then the patient is told to be cautious all the time.
Exactly. So important tips that you gave us is that if it's mild, you can use just general medicines like antihistamines and avoid the foods. If it's more serious, obviously then you have to carry an EpiPen, especially if you're worried about anaphylaxis. And then the medical bracelet, we can't emphasize that more. If you have a life-threatening reaction to food allergies, then people need to know that. There's no way they can guess it.
Exactly.
And so the point being is that education is a key. You know, it's tough to read food labels, but if you have the allergy, you must do that. And don't be afraid to advocate for yourself. When you go to a restaurant, go somewhere, you gotta let them know, I have this problem, and please don't give me this type of food. Great tips. When we come back, Dr. Dhillon and I will answer questions from our studio audience. Please stay with us. Nice. We covered everything.
If you get allergy shots against pollen, mold, or any trees or grass, the allergy shots will help your immune system to develop antibodies against that particular allergen so that that particular allergen doesn't affect your body.
Good audience. Welcome back. Thanks for staying with us. It's now time to take some questions from our studio audience. Dr. Dhillon, there's some questions about food allergies. Okay?
Sure.
Very good. Yes, please.
Hi, doctors.
Hi.
I was wondering if allergy shots can weaken your immune system.
You know, people think that's a good question. Dr. Dhillon, allergy shots, can they somehow affect your immune system and weaken them?
Well, I think that's a good question. Actually, the allergy shots, they help your immune system to develop some tolerance to the allergens which they are introduced against. For example, if you get allergy shots against pollen, mold, or any trees or grass, the allergy shots will help your immune system to develop antibodies against that particular allergen so that that particular allergen doesn't affect your body. So they do not weaken your immune system, but there's a certain myth there that when we start patients on allergy shots, that they can weaken the immune system against bacteria and viral infection. But
That's not true. Yeah, people think that because, you know, the whole an allergy is an immune reaction, if you stop that immune reaction, it'll stop it to everything.
Right.
Because they're afraid of it. No, but tell the audience at home, what is an allergy shot actually?
Allergy shot is only given for airborne allergens and also for venom hypersensitivity, which means patients who have wasp or yellow snake hypersensitivity, those patients, they can receive weekly to bi-weekly shots and in small and escalating dosages.
So they have the same stuff that they're allergic to. So basically it's the same stuff you're allergic to given in small shots.
Yes.
So your body doesn't have a huge response to it, but slowly so they can get used to it.
Absolutely.
And then when they do have enough, whether either taken by mouth or whatever the allergy is, they don't have the reaction they normally do,
exactly.
Right?
It's very diluted serum, and which is given in escalating dosages, and slowly the body's immune system develops a tolerance to that particular allergen. So it just helps to fight that allergic response without medications.
So, you know, instead of weakening it, you're just having your body get used to something so you don't develop the reaction that you don't want.
That's right.
It's a good question because a lot of people ask that. Next question. Yes, ma'am.
Hello, doctors.
Hi.
Do food allergies get better with age, or do you always stay allergic to the same foods?
So we talked about that. You know, Dr. Dhillon was talking a little bit about that certain allergies can get better. You have it as kids, but as adults, they go away. What do you think, Dr. Dhillon? More detail about
As you heard Jen's story, she had multiple food allergies as a child. Most of those patients, they will outgrow some of the allergies. How can we tell is by doing food challenge. Down the road, if that patient is having exposure to milk or eggs and they do not get the same reaction, this means they have outgrown that allergy. But if anybody who has anaphylactic reaction to that food should not be tried.
Absolutely.
So if there's just food intolerance, food allergy like gastrointestinal symptoms, that food definitely can be tried at a later stage and you can outgrow certain allergies. But certain allergies with like tree nuts and pistachios,
almonds, cashews,
they most of the time the patients don't outgrow that allergy, and same thing with shellfish and other fish allergies. Patients most of the time they do not outgrow those allergies.
So you know, important question. If you have a child, are they going to have it lifelong? It could be with like Jen, but lots of kids actually outgrow some of the allergies. And an important concept brought up is that with the help of an allergist and with the help of your doctor, you can introduce food challenges to see what happens when you have a particular food, and do you then get better as you go along. Obviously, if you have a severe reaction, like an anaphylactic reaction, then you're at home listening, you cannot try that to see what happens. But others, you can definitely give it a try, because it's hard for kids. It's hard for kids, and if we can slowly over time, if they outgrow it, it's even better. So good question. Yes, sir.
Hi, doctors.
Hi.
Can we predict how severe a food reaction may be based on reactions from previous events?
So it's almost said if you ate something and it was mild, is the next time you're going to have a reaction? Could it be severe or mild? What do you think, Dr. Dhillon? Some things are like that, where you can predict a reaction, but often with food allergies you can't, can you?
Absolutely. With food allergies, it's very difficult to predict a response of any particular allergen. And also, there's a general myth that the food, if it's taken repeatedly, the reaction will get worse and worse and worse. But for the most part, the reaction stays pretty similar. But the only thing is very hard to predict the length of the allergy exposure, because it's dose dependent. Sometimes you can have just one bite of a fish and you can get mouth swelling or lip swelling or tongue swelling. And sometimes the patient has eaten half of the fish and you still don't get a reaction. It's very hard to predict, but generally the reaction, it'll stay the same. But depending on other food allergies which you have, they can be compounded. You can get a
compounded reaction with other allergies.
Exactly.
So the question is that, can you predict? It's difficult to predict. Obviously, you said the amount you eat and it can go up and down. The reaction may be similar, but the interaction may be different. So just because it was mild before, I would go and see a physician and find out if you truly have an allergy to it and not try it. Only try to take a food that you're allergic to under the guidance of a doctor, and you can suggest, introducing food back and food challenges.
Depending upon if the patient has food intolerance or food allergy. But for the most part, the foods which has caused anaphylactic reaction in the past, it shouldn't be tried at all.
Definitely, very, very good advice. Again, the key is work with your doctor in partnership to solve these problems, because they're available for you. And eventually what will happen is that you can work as a team and figure out what to do.
Yes.
We have to take a break. After we come back, more questions from our studio audience. Please don't go away. The body thinks that the food is dangerous, or the food is like a bug or like an infection, so it's attacking it and giving you a reaction. Welcome back again. Thanks for staying with us. When you left us, we were answering questions from the studio audience about food allergies. Yes, sir.
Yes, doctors. I was wondering, how much food does it take to have a severe reaction?
So you may think that that it takes a substantial amount of food, but we were talking before, even a little bite can really cause problems, and that's why in schools, you have people with certain nut allergies, and you have to really avoid it completely. What do you think, Dr. Dhillon? Does you have to have a whole lot of food to get an allergy, or no?
Well, I think the question is, how much food does it take to cause a food allergy reaction? If you have anaphylaxis, even one bite can be fatal. That's it's not sounding too threatening, but that's a true
absolutely
essence of it. If you have any nut allergy, one bite of that nut can cause anaphylaxis. But if you have GI symptoms or lip or tongue swelling, I'm sorry, not swelling, just itching, if you get skin rash, and if it's mainly GI symptoms, it could take like couple intakes of that food, or I would say a couple servings of that food, to cause a major reaction of diarrhea and abdominal pain. But of course, as I mentioned earlier, again and again, if you have anaphylaxis, that food should not be tried again. But if you think that you've outgrown that food allergy because you have taken that food in small amounts at some other place, it's worth a try if you just get food allergy reaction with GI symptoms, which is the gastrointestinal symptoms.
Exactly, great advice. There's no hard and fast rule, which means that there's no definite rule for everybody, and some people, you have a little bit of food and they can get a reaction. Anaphylaxis or life-threatening, it's completely, you don't want to even try it, and it could be even a little trace of a food that can cause a problem. The way you can think about that is having a bacterial infection. If you have a bug, sometimes if a bug comes in your system, your body attacks it. And the same thing, the body thinks that the food is dangerous, or the food is like a bug or like an infection, so it's attacking it and giving you a reaction. And that's the reaction you're getting. So, in certain cases, you have to have a lot of infection for you to get symptoms. Exactly. Others, you may need just some organisms are so lethal that you just have one a few organisms and you can die. And so with food allergies, think of it that way, that your body doesn't know it's food. Your body thinks it's a foreign substance attacking your body, and it's unleashing all of its power to get rid of it. And it could be very mild if the body thinks it's a mild, but if it thinks it's severe, if your body's prone to that, you can have a severe reaction. So again, my advice is that use the guidance of your physician, use the guidance of your allergist to say, you know what should I do? Should I try to introduce these foods back and have a food challenge under the guidance so you know? I wouldn't try to predict based on the fact that I can have a little bit of this or a little bit of that and try to plan it yourself, but rather use your physician, use your partner in healthcare as your guide. So good question.
Yeah.
Next question, please.
Hi, doctors.
Hi.
Hello.
Can food allergies cause migraines?
We've talked about that. Some patients have asked, what's the relationship? Is food allergies actually causing some migraines?
Well, actually, the food allergies are not related with migraine headaches, but food intolerance is. And that is a spectrum of food intolerance. The patients who have migraine headaches, if they eat tyramine-rich foods, they can get a migraine headache right away. And those tyramine-rich foods are like aged cheese, bananas, teriyaki sauce, and there is a whole list you can get from a lot of resources. But it's not a food allergy, it's a food intolerance. Those foods, they contain an amino acid called tyramine, tyrosine, which gets converted into tyramine, which can cause vasodilatation and which can increase the blood pressure.
So vasodilatation just means the blood vessels get dilated or bigger.
Exactly.
And that's one of the mechanisms of migraine, we think. But go ahead,
exactly.
please.
And that is how the migraine can be triggered, but it's not a food allergy, but it's a food intolerance.
Yeah.
So any patient who has migraine headache should be warned about tyramine-rich foods. And also the patients who are taking MAO inhibitor medications, they should not use tyramine-rich foods at all.
Yeah, so the idea behind migraines is that, it's like you said, it's a food intolerance, and it can lead, if those foods have the tyramine-containing products, they can cause vasodilation, where the blood vessels get bigger, and that can lead to migraines. So it's not so much a causative, with food allergies, but maybe related to food intolerance. But good question. Yes?
Hi, doctors. I've heard of this hygiene theory that explains the increasing factor for food allergies. What exactly does this theory explain?
Important question. The hygiene hypothesis, that we're just so clean that the immune system doesn't recognize when there's something that's not a foreign substance, that it's not a bacteria. We've been talking about this for various allergies or various allergic reactions, autoimmune conditions, even in diseases that I treat, which is Crohn's disease. People think, if the hygiene hypothesis, we are so fixated on being clean that the immune system hasn't been challenged, so then all of a sudden has an abnormal challenge or reaction. And so, that people have been talking about. It's difficult to prove, but I think that they have in farms or other places that are more urban, that are more suburban and rural, that people see that if you have exposure and you have some infections, that your immune system has been challenged, that maybe these autoimmune or immune reactions don't occur. Would you agree, Dr. Dhillon?
Absolutely. I think you had a good explanation of the hygiene hypothesis, which is a very prevalent theory in medicine. In the hygiene hypothesis, our immune system in early childhood, if it's not exposed to all these infectious agents, it does not mature the immune system.
It becomes dysfunctional.
Exactly.
And that's a very good point. Dr. Dhillon, thank you very much. I really appreciate you coming by and spending the time to help with food allergies.
Thanks for inviting me.
And Jen, very, very important to share your story with us. When we come back, Partha's Prescriptions, please don't go away. Welcome back. Thanks for staying with us. Now, today we've discussed a disease affecting 15 million Americans, food allergies. What can we take away from today's Partha's Prescriptions? Number one, be proactive. If you suspect that you may have food allergies, please see your allergist for testing that can save your life. Number two, be informed. Read labels carefully to understand what the ingredients are in different foods. This can be critical in preventing a reaction from food allergies. Number three, if you have food allergies, ask your doctor if an EpiPen is right for you. In the case of a severe reaction, it can be critical. Number four, If you've been diagnosed with food allergies, wear a medical alert bracelet so others know your allergy even when you can't communicate. For more information on food allergies or an archive of our previous topics, please visit our website at www.askdrnandi.com and join the discussion on our Facebook and Twitter pages. Just search Ask Dr. Nandi. Lastly, there's a beautiful word in the Hindi language that literally means the light in me honors the light in you. And that word is namaste. So namaste, each and every one of you. Thank you for watching and see you next time.